today's episode, we'll be following two of our newly hired nurses, Allie and Cassie. If you missed last week's episode, you did miss out on a riveting enema insertion and an emotional moment between a nurse and an Islamic cancer patient. But have no fear, today's nurses are in store for an exciting day on the floor. Let's start by getting to know a little bit about each nurse.
Hi, my name is Cassie. I'm a new graduate here at Simulation Regional Hospital. I've heard nothing but great things about the faculty and staff. I hope to learn from the experienced nurses and better myself in my profession. I am especially excited to work with Julia Kane, a nurse practitioner that I've heard so many great things about. Thank you so much for choosing to follow me, and I'm really excited to represent the nursing profession.
Ah, such a marvelous young lady. Now let's get to know our second nurse, Allie.
Sup, I'm Allie. I'm pretty new to this nursing thing. My motto is YOLO, you only live once, so I think I'm just going to wing it and learn it from my mistakes as I go. I'm pretty stoked I snagged this job because I'm new to this, but I can't wait to check out all the sexy doctors.
It's the nurse's first shift. Let's see how they start their day. Cassie is getting a report on her patient from the night shift nurse. Note how she is writing down information in her nursing brain sheet and proceeding to study the patient's charts to gather more specific information. Allie seems to be dozing off during her report. Let's hope she got the information she needs. Now we will observe the nurses preparing their first patient's daily medication. Cassie is preparing a dose of insulin and some oral medications. Note how she carefully checks the orders for the patient. She is verifying with another nurse that the insulin is the correct amount of units. I know all of you are at home are on the edge of your seats. The intensity is almost unbearable. Now let's observe how Allie prepares her medications. Oh my. Well, this is an unconventional method to say the least.
Digoxin, what a funny name. Great, a laxative. This guy's going to be pooping all day. A little morphine. This guy's going to be feeling real good later on. A little too much. There we go. Let's go do this. This one's going to be high maintenance today. Hey doctor, how was your weekend? I hear the party at your place got a little wild. That is too funny. Anyways, back to the patient. We have a male that has shortness of breath. His pulse ox is lowered from about 99 to I think about 88 last time I looked. His wife continues to yell at every nurse to do something. So this patient has CHF and I think he has had an MI about 6 months ago. His vital signs when he got here were temp 98.6, pulse 88, respiration 16, blood pressure 131/88. I haven't checked them recently, so I don't really know what they are. He claims his pain is a 7 on a scale of 1 to 10, but I think he's just whining. I have no clue what is wrong with this guy, but I guess it could be an MI.
Somebody, help him!
Yeah, that's his wife yelling in. Ugh. You need to get down here. You're crazy. See you soon.
Hello? Oh, yes, this is Cassie, an RN from the first floor at Simulation Regional. Yes, I'm familiar with Carlos Martinez in room 105. He has become extremely short of breath with a pulse ox dropping from 98 to 88. He complains of radiating chest pain. Mr. Martinez is a 32-year-old male with CHF and MI. He was admitted last night with dizziness and chest pain. The patient has been put on 2 liters of oxygen, which raised his pulse ox to 94%. His respirations are 28 breaths per minute. His pulse is 108. His blood pressure is 88/55. Patient has stated his pain level is 7 on a scale of 1 to 10. Mr. Martinez's wife is present and very anxious. He is full code. Mr. Martinez continues to worsen and I am very concerned. I think the patient should be assessed as soon as possible. Are you available to come in? Are there any tests you need done? Okay, so take vitals every 15 minutes and give 8 liters of oxygen. Okay, I've got it. See you soon, doctor.
Hospital policy at Simulation Regional states an RN can accept verbal orders over the phone. Meanwhile, while Cassie was clarifying info with the doctor on Mr. Martinez, Allie was in a patient's room. Let's take a closer look at what went on.
What are you doing? You should know better than to have a candle and oxygen in the same room.
That is my stuff.
Well, your stuff does not belong here.
Hi, Mr. Martinez. My name is Cassie. Are you okay?
I guess.
Yeah, well, I see you have a candle here. Due to safety reasons, you're not allowed to have that. Would you mind if I find a battery-operated candle for you?
I guess that would be okay.
That would be okay? Well, I'll have someone look for that for me. Well, you seem to be really upset, and I see you have a rosary here. Can you tell me what's that for?
It was my father's. He gave it to me when I was a boy.
Oh, he did?
It reminds me of his strength.
Okay, well, I'm just going to take your vitals, and then in 15 minutes I'm going to retake them, and then the doctor will be here shortly, okay? And then I'll have someone look for that candle for you.
Okay.
Okay?
Watch out, folks. Dr. Strickland's here.
Sup, Doc? I expect an invite to the next party.
Of course. And while I have you here, patient in 302 wants to speak with you.
Thank you.
No problem. When you're done, come and find me.
Hey, sweetheart.
Sup? I've been looking for you all day.
Well, I'm here now. What can I do for you?
First, let's start with a hug. You always brighten my day.
Oh, are you sweet? You would make such a great boyfriend.
Actually, that's what I wanted to ask you. Would you like to go on a date with me after I get out of here?
Where were you thinking?
Wherever you want to go.
Are you paying?
Of course. I would never let you pay.
Okay, honey. Sounds good. You let me know when you get out of here. My number is XXXXXX. You wanted to see me?
Oh, yes. I was noticing how beautiful you are.
Thank you. I'm glad someone finally notices.
I was wondering if you would like to go to dinner sometime.
Will there be wine involved?
Only for you, gorgeous.
I'm there. Pick me up from my place at 8. Here's my number.
Dr. Strickland, I've been looking all over for you. Did you get a chance to assess Mr. Martinez?
Yes, sweetheart. And while I'm thinking about it, patient in 302 requests to see both of his nurses as soon as possible. Come back and find me whenever you're done.
Okay. Hey, how are you? You requested to see me?
Yes, I've been looking for you all day.
Well, what can I do for you?
Well, I've been feeling down lately, and I was really hoping to get a hug.
Sir, I cannot do that. That's against policy. Is there anything else I can do to make you feel better?
Well, even better than that, once I get out of here, maybe you could accompany me on a date?
Sir, you're making me feel really uncomfortable with that request.
Well, I'm sorry I didn't mean to make you feel uncomfortable, but you're just so beautiful.
Thank you, but that is not professional of me to accept your offer. Is there anything else I can do to cheer you up?
No, I'm fine for now. I'm so sorry for crossing the line with you. You're
Okay.
a great nurse.
Thank you. Just call me if you need anything, okay?
Okay.
You wanted to see me?
Oh, yes. I was just noticing how beautiful you are. Would you like to go to dinner with me?
Doctor, that is against hospital policy, and I have continuing education classes that I attend in the evenings.
Come on. You can't turn down all this.
Yes, sir. I respectfully decline, and I need to get back to work. Let me know if there's anything you need me to do concerning our patients.
Well, the time has come for us to say goodbye to our nurses, although we aren't the only people Nurse Allie is saying goodbye to. Simulation Regional Hospital has informed us that Allie was let go soon after filming due to her inappropriate actions and unprofessionalism. We hope that today's show has opened your eye to the profession of nursing and how important it is that nurses are recognized as competent, knowledgeable, and detail-oriented professionals. We are told Nurse Cassie was recognized for her outstanding care and continues to attend courses and hopes to receive her master's degree. Cassie, can I have your autograph?
For you?
I'm sorry I made you feel uncomfortable. You are just so beautiful. I'm feeling down lately.
I'm sorry. That's against hospital policy. Is there anything else I can do for you?
Actually, even better if you could accompany me on a date after I get out of here.
I'm sorry. You're making me feel really uncomfortable with that request. Is there anything else I can do for you?
No, I'm sorry for making you...
Such a lively bunch.
See me?
Okay, you requested to see.
She wasn't looking. She wasn't looking. She's laughing. Oh my god.
Is that good?
Yeah.
Okay.
Oh, good thing.
That is what I wanted to ask you. When I get out of here, would you like to go to dinner? How's that? Dinner? Are you filming?